Absolutely.
So I'll just step in here and add a bit
please.
more. So there are certain indications which are called as absolute indications for surrogacy. Absolute indications would be a woman born with something called as an MRKH syndrome, which is a congenital disorder, chromosomal disorder. So a female would be born without a uterus in that condition. So there's no other chance than surrogacy. There's no other option for us. So when she walks in, you tell her that this is the only option for you right now. So that is an absolute indication. Another absolute indication would be a woman who's undergone a hysterectomy, where she was trying to have a baby, and during delivery or during childbirth she bled a lot, and the doctors didn't have an option but to remove the uterus to save her life. That is another absolute indication. A woman who's diagnosed with cancer of the ovaries or any other body part. A woman who's been diagnosed with, who's undergone a renal transplant, for example. She's only one functioning kidney now. She's on dialysis. She cannot carry a pregnancy. So for these cases, surrogacy is an option.
You
These
said cancer of any kind.
Yes, cancer of any kind. Because, for example, if she's undergoing chemotherapy.
So she won't be able to.
Because when you are yourself carrying a pregnancy, whether naturally or through fertility treatment, you have to take sometimes some hormonal supplements, like progesterone, for example. This may cause a relapse of the cancer, or certain drugs might cause a relapse of the cancer. So these patients, you advise surrogacy. Then there are some non-absolute indications, like Madam just said, right? Somebody's undergone multiple failed IVF cycles, or somebody who's had multiple miscarriages, where her uterus is not supporting the pregnancy, or where they have preterm or premature delivery. In these cases also, you advise surrogacy.
Yeah. Yeah. And are there any legal bindings in all of this? Like, is there any kind of legality which parents have to?
Yes. Now there's in place what is called as a Surrogacy Regulation Act. So now this act specifically specifies who can and who cannot do.
Okay.
For example, it has to be a married couple between the age of 21 to 50 years for the female and 21 to 55 years for the male. And the indications which I just said, those indications, you cannot do it for lifestyle reasons. You cannot do it any longer for lifestyle reasons. You have to have some medical indication that you can do it. And then you have certain indications where, you have to take permissions from the various authorities nowadays.
Yeah.
So the patient has to go to the district medical board, submit their documents, take a supporting letter from us, get those permissions, and then they have to provide insurance for the surrogate mother and to take care of any kind of complications during pregnancy. And then a magistrate is going to give a birth order stating that the baby born through surrogacy is going to be the child of the parents and not of the surrogate mother. So there's a whole list of indications that
Indicators.
So it's no more commercial surrogacy.
It's going to be altruistic.
Altruistic means the lady has to be some relative of the lady.
No, not a relative. It doesn't have altruistic means there should not be any commercial
Connect. Yes.
It doesn't have to be
Not
related.
commercial but altruistic. And
She doesn't have to be related. She can be a known person. Yeah.
Okay.
Any willing lady, she can be a surrogate.
Got it. But not commercial. It cannot be a business.
And then it's only allowed for Indian citizens again.
if you are an Indian
You cannot have foreign passport, holders or foreigners coming in, which was legal a few years back.
Some time back.
Now it is not.
That's a big, regulation passed by the Indian government.
A big shift.
And for the single women and for widows
Yeah.
and for divorcees, ladies, who are, they are also allowed.
For a lady who is a widow
And divorce.
or a divorcee between the ages of 35 to 45 years of age, they can only do a child through surrogacy. A single lady who is unmarried, she
Cannot.
cannot do. Neither can gay or living in couples, they cannot do it either.
So very clearly this whole lifestyle factor is out. Like there was a time when it became a trend, even in Bollywood. Let's have children and through surrogates.
Yeah. So,
But
basically, 99% of the cases that were done were always for medical issues. These cases get highlighted because, obviously the media picks it up because it's a nice story. For example, somebody personality in Bollywood or a sports personality doing it. It is news.
Yes.
But the majority of the cases were always for medical reasons.
Yes. That's a very important point you made, that it also depends on how the media is reflecting these stories. Absolutely. Yeah. So I mean, there would be, I suppose, just one small question attached to this would there would be single women and men who want to have children, just like they want to have children, they don't want to get married. So why do such people come to you?
Single woman, yeah, I think single women can go in for IVF and
Yes.
IUI through donor insemination and donor IVF. Surrogacy is what he's talking about.
Yeah,
is not
that's
like
different.
that.
That's different.
Yeah.
So, but I'm just asking as an extension. Given
For single women, yes, it's Mother's Day, so single women can. Single man can't. So, in our country, I think this matter is now being heard by the Supreme Court as
Court.
well, in relation to the LGBT community and their rights in terms of adoption and having a baby through fertility treatments, even surrogacy. So, a single male can't in India. So, a lot of men who can afford it are going abroad and doing it. For example, the US or certain countries in Europe where they are allowed. But single women, they can have a baby through surrogacy, through IVF in India.
I feel it's very unfair, like you're allowing a
woman
to
too.
do that, like why not men? Because
Yes.
recently I saw somebody, from the IT department writing like that, the guy, 38, 40 years old man, and I recently got divorced, and I want to do the baby with IVF technology.
Yes.
So I would take an egg donor and like put it in the surrogate or whatever it is, and whatever baby is born, I am capable of taking care of that baby. Because even adoption is very difficult for them, it seems, for single men.
Yeah.
If they go for adoption also, they will be given only a male baby itself. They will not be given a female baby. Because there are again certain things like
Sure.
adoption problems there. So he said that I cannot take I cannot adopt a baby, I cannot go for surrogacy, and what should I do?
Yeah. So your world is full of riddles, actually. The way I see it, there is a lot of there are a lot of pros and cons to everything. So there's a lot of talk of stem cell therapy, PRP, the platelet-rich plasma. Does it cure infertility?
Yeah, the magical word for the last 3-4 years has been the stem cells. Stem cells are actually the mother cells, because all of us came from 2 cells, one sperm and one egg.
Yes.
And then when we were implanted in our mother's uterus, when we entered inside the cavity and we formed an embryo, we were about 160 cells or 180 cells, and we had all the 3 layers which formed the ectoderm. Ectoderm means our skin, endoderm means our skeletal system, and mesoderm and all is our organs and uterus and everything. So we all basically came from 3 layers. But these totipotential cells, totipotential means it's a mother cell, it can form any kind, it can differentiate into any pathway, we direct it to.
Yes.
Like we want it to become an oocyte or oogonia.
Okay.
So we can direct it towards that side, So these stem cells, fortunately, are found in our own blood. If we take our own blood, 20-30 cc, and then centrifuge it at a particular revolutions, we get 2-3 times we centrifuge, we get plasma, platelet-rich plasma.
Yes.
That is, not the RBC, not the WBC, but plasma which is rich in platelets. Platelets means, like we all know that they are the ones which help in the thrombus formation and clotting of the blood, and also these platelet factors can be, isolated and they can be injected into any organ, like for the brain surgeons and all, for the brain, for the orthopedic surgeons in the bone, in the cartilages and all that, and for us, like regenerative medicine for the ovarian rejuvenation. How it started was, this PRP, ladies who are undergoing menopause. She said, I'm 40-45 years old, now I'm actually losing all, those female qualities. So why not I rejuvenate my ovary and produce estrogen? So
Sure.
when they injected these cells into her ovary, by a very small process, not a big process, and then what happened is that she started again making hormones and eggs, and also again all those things came back, the little bit youth came back again for another 5-10 years. So then they got the idea, why not we do it for regeneration of the eggs? Because what we were taught is how many eggs you bring from your mother's womb. See, a girl has eggs, 6 million eggs, when she is a 3 months old fetus in her mother's womb. 6 million nature has given, And then they undergo what is called as, like self-death.
Got it.
Autophagy, that is called as. So that cell death happened, and when we were born as girls, we had 1 million eggs. And when you reached menarche at the age of puberty at 12 years, we had less eggs, only 3 lakh eggs.
Okay.
And as she was telling you, every day you are losing 30 eggs. So you can calculate.
That is some line, huh? Really.
And
To the lady, I think she'll be more.
Totally.
Every day she'll realize, okay, I lost my
Another
30 eggs, let
30.
me go and meet the clinician.